The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today's show is all about you. Did you make a resolution to get healthy and stay healthy in 2013? Well, we're here to help. Joining us today are three very talented physicians to help answer your burning health questions. Dr. Carter Gray with Atrium Obstetrics and Gynecology, Dr. Grace Tang with Rex Family Practice of Wakefield, and Dr. Ben Walker with Rex Heart and Vascular Specialist. They're going to be here to answer your health questions. If you're watching us live now and you have questions concerning how to feel better and this year, call in now. Your questions may be answered here live on our program by those experts. To call us here at Rex on Call, just dial the number on your screen. In Wake County, 919-744-3876. Outside of Wake County, call toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can even email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. And today is all about you. So we want to find out your top questions for our experts. And here are a few just to get us started.
What is probably, I guess, the most important thing to work on for someone for all-around health, emotional and physical health? What would be like their main advice? Would you focus more on diet, exercise, or both?
What could guys like myself do in mid-late 30s to reverse heart disease? What can we do to prevent and in some cases reverse heart disease so we can live long, healthy lives?
I am curious to ask if I am more tired, like physically sleepy tired because of my age, because I'm getting up in years.
Or if it's something else?
Could it be health related? I'm not as physically active as I used to be, so I'm curious if age has something to do with the fact that I seem to be more sleepy more often.
I want to know the answer to that too, because I'm tired all the time. Yes, I am tired all the time. So let's get back to that question number one. Should we focus on diet, exercise, or both? What's the answer?
Both.
Both. Okay. If you don't have a ton of time to exercise, is it possible to improve your health by just focusing on diet?
Yeah, I think one of the important things when you're trying to lose weight and get in shape is to realize you have to burn something off and you also have to decrease what you take in. And however you want to do that balance is important. Whether you do really well with your diet or really well with your exercise, you have to make that calorie intake go down at some point.
Okay. Our next question there was there anything you can do to reverse heart disease? So talk to us about that. Yeah, a lot of times it depends on what the underlying condition is. We focus a lot on secondary prevention, so recurrent events like recurrent heart attacks or worsening heart failure. Diet and exercise is a good starting point. Also making sure all of your modifiable risk factors like cholesterol and blood pressure are under well control with your primary physician and your heart doctor. Okay, this one, fatigue. Is it because of age? Is there how do you find out the source of some overwhelming fatigue?
That's a big question, but always you want to start with your doctor and getting some tests done, like checking for anemia and thyroid disease. What I see a lot of is a busy lifestyle and not getting enough sleep, so you always want to make sure you're getting adequate sleep. Sleep apnea is another cause of fatigue that goes undiagnosed a lot. So there's a lot of issues that could be happening.
Something definitely to see your physician
Definitely.
about. Okay. Now, there are new regulations concerning how often a woman should get a pap smear that I think a lot of people may not know about it. Can you talk to us about why that's happening?
Sure. That's a great question because I think we've always used the pap smear as the carrot to get people to come into the office, which is great. That's where we find heart disease and diabetes, depression, other issues. But now that we understand kind of the nature of the HPV virus, we can change how we are screening for it. So pap smears should start around the age of 21. Now, prior to that, if you are sexually active, you still should come in and get, STI screening. Beyond that, some people will do pap smears every 2 to 3 years in the 20s. And then once you are 30 and you're in a monogamous relationship, we typically will test you for the HPV virus along with your pap smear, and then that will determine whether or not you can go every year to every 3 years. Now, obviously, between that, if you start having other issues going on, we might elect to do a pap smear sooner as opposed to later.
But are you still then, but the women should still be going every year?
Definitely, because sometimes a lot of women will only have an OBGYN as their primary care physician, and so we need to check on your weight, check on your lifestyle, check on blood pressure, all that. And if there are big problems, we typically refer them over to a primary care physician like an internist or a family doctor.
Okay. And Dr. Walker, you're big on getting people moving and reducing screen time, and here we are on a TV show talking about this. So I feel like people need to be doing jumping jacks while they're watching, but talk to us about your mission here.
Yeah, I was joking with this earlier. We should all get up and start doing some exercises and turning it into some type of infomercial maybe. But I think it's really important for people to realize that being active doesn't necessarily mean going to the gym and running on the treadmill for 10 miles. Just by changing your lifestyle, taking the stairs, parking on the far end of the parking lot, and then decrease the amount of screen time in front of your tablet or your computer. And when you are in front of those, try to be active, whether it's just doing housework or doing exercises. It can really benefit you in the long term and helping to decrease your weight and also help prevent things like hypertension and diabetes that can lead to cardiovascular disease.
Do you think because of all these screens we have access to, are you guys all seeing a reduction in activity? You think?
Yeah.
Definitely.
Yeah. And the kids are not exercising as much. Adults say they don't have time now. And so really 30 minutes of walking a day, and we talked about diet. I always like to tell people that if you eat 100 extra calories a day that you're not burning off, that's 10 pounds in 1 year.
Wow.
So if you can reduce a little bit, exercise a little bit, it's a good way to start.
We also talk to our patients about how it doesn't have to be 30 minutes at one time.
Right.
It could be 10 minutes in the morning, 10 minutes at lunch, 10 minutes in the evening. Another tool that we sometimes use is a pedometer to say, can I get 10,000 steps in a day? And sometimes we're impressed by how much we get in a day, and then other times we're surprised at how little we get in a day.
It's very eye-opening.
And we also encourage a lot of exercise during pregnancy. I think some people forget, oh, I'm pregnant, I'm eating for 2. It doesn't work that way, but we definitely encourage exercise and continuing with your exercise regimen during pregnancy.
But I was hungry enough for 2, I tell you. Yes. The flu is obviously a hot topic right now. Talk to me about what you're seeing in your office.
We were seeing a lot. I'm a typical family practice office, so we don't see as much as urgent care, but there was a huge spike, but now it seems to have leveled off just a little bit, so we're not seeing quite as much now.
Okay, but do you feel like there might be another wave coming our way?
There's certainly, February is typically a really bad month, so there could be another peak in February. We just don't know yet, so it's definitely still important to get your flu shot if you haven't yet.
Okay, it's not too late to get a flu shot?
No, not at all. Flu season can go all the way into spring, and so it's not too late, and there could be different strains coming in February that you want to protect yourself against.
Okay, and are the pregnant women in your office getting flu vaccines?
Yes, we vaccinated most people in October, but those who have not been vaccinated, we still recommend. Typically the vaccines we use now are thimerosal-free, so they don't have the preservative, which was some of the fears of mercury with the unborn children. But we definitely recommend flu vaccines while you're pregnant.
Okay, great. Now we're going to be back after this break to answer your questions. Give us a call in Wake County, 919-744-3876. Outside of Wake County, toll-free 877-277-6252. Email us at rexoncall@rexhealth.com. And coming up, we'll have our experts weigh in on questions like these.
I'm vegetarian, and what would you recommend for my protein source? Since I'm strict vegetarian, and I sometimes get confused. Should I just do beans? Should I do a supplement? I'm not sure.
Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on getting healthy and staying healthy in 2013 and beyond. If you have questions for our experts, call those numbers on your screen right there, and you can even email us at rexoncall@rexhealth.com. Now, we heard from a woman wanting to know if she should be taking a supplement or different ways to get protein. Now, here's some more nutrition questions as well.
Is there any particular foods I should be eating?
To stay healthy?
Well, to stay healthy, to lose weight more so.
Oh, okay.
My New Year's resolution is to run a full marathon. And my question is, what are some of the things that I need to look out for to make sure that my body's in shape and that I'm not going to damage anything come time for the run?
Okay, let's start nutrition in terms of protein sources if you're a vegetarian.
Soy protein is a good way to get protein. Legumes is another good way to get protein if you're a vegetarian.
Okay, and how much should we be aiming for in terms of grams of protein? Is there a target?
I think it depends on how much you're exercising, but I think it's all about the food pyramid. Well, it's not pyramid anymore, but looking at your plate and having your plate mainly full of fruits and vegetables, and then adding some whole grains, and then adding also some protein in. You can also do it through eggs or egg whites, but it depends on if you're a vegan or a vegetarian.
Right. And there was a question about, are there certain foods that kind of boost weight loss? I mean, these are all those crazy, the diets, that they focus more on protein or focus more on low fat. Is there one that works better than the other?
I think less food.
Yeah, that's right. Moderation works the best.
And having a lot of small meals a day is important too. A lot of people skip breakfast because they're in a rush, but getting your metabolism starting early is very important.
It's that whole moderation thing that I have trouble with. Okay, and then there was something, we had a question about running a marathon and just the physical demands of training like that.
I think one of the things is to make sure you don't do too much at one time, and you'll injure yourself if you just go from sedentary to trying to run a marathon. So building up to it, to make sure all your muscles and everything is in shape gradually. And that comes with time. You can't prepare for a marathon in a month.
Right. Okay, this is a caller from Youngsville. This is Judy. For the past year, has an itchy nipple on her breast, but also may feel a lump under her arm on her right side that's painful. She doesn't have insurance.
That's a hard one. And that's something that she definitely needs to get looked at because we do worry about breast cancer and other issues. Sometimes
and Rex Hospital has some programs to help out, so we can follow up.
Definitely, but she should contact them to see if she can get seen by a physician.
Also in Youngsville, there are some free clinics. There's a free clinic out in that neck of the woods as well.
Okay, so there is access. There is access. Okay, this is from Herbert in Raleigh. He's 65 years old. When he bends over and he stands up, he feels like he's about to pass out. He's on blood pressure medication already. Why is this happening?
Sometimes when you're on too much blood pressure medicine, it can make it too low. And whenever we go from laying down and standing up, all the blood in our body pulls down to our ankles. Okay. So it's important for maybe him to check his blood pressure when he's feeling this to see if it is going too low, and then maybe he needs his medicine adjusted by his primary doctor. That'd be a good place to start.
Okay, this is Brenda. She has diabetes and has a burning, stinging, itching feeling in her feet.
So a common condition in diabetics is something called diabetic neuropathy, which is where you get a burning sensation. Sometimes people feel numbness in their feet, and better sugar control can help that. But also there's some effective medicines if that's what you indeed are diagnosed with. So definitely go see your doctor about that.
Okay, good to know. Coming up, we're going to be answering more of your questions. Call us on those numbers on your screen. We'll be right back to answer these questions. Welcome back to Rex on Call live on WRAL. To reach us, calls 919-744-3876 in Wake County. Outside of Wake County, calls toll free at 877-277-6252. We're here to answer your questions about how to get your 2013 off to a healthy start. And as part of knowing, part of being healthy is where to go when you're sick. When we went to Rex Express Care of Wakefield to find out when an illness can be treated at an urgent care and when you should head straight to the ER. Dr. Colway's seeing a lot of flu, pneumonia, and other respiratory illnesses. A lot. She hasn't seen it like this in years. This little guy is getting a breathing treatment to help settle his cough. This is one of the many treatments they can offer in an urgent care setting.
We advise patients who are, if they're having only mild respiratory complaints or mild shortness of breath, we can take care of that here usually. But if someone has severe shortness of breath, terribly high fevers, excessive fatigue, they are not keeping fluids down, they're not able to tolerate medications, we're recommending that that be seen in the emergency room setting.
For non-life-threatening issues, express care centers are certainly more cost and time efficient, with much lower copays and wait times than an emergency room. When to head to urgent care? With their on-site x-ray and laboratory services, you can go to an express care for cuts and sprains, testing for flu, mono, and strep, sinus infections, sore throat, earaches, and minor abdominal complaints. Head to the emergency room if you have chest pains, obvious fractures, pregnancy complaints, uncontrolled bleeding, and severe shortness of breath. And Dr. Callway says there are times to call the paramedics for even more immediate help.
Someone who is having such severe shortness of breath that they really can barely even speak full sentences, or they're feeling severely lightheaded or chest pain with the shortness of breath, they're having difficulty getting up and around as far as driving themselves here safely, those are indications to call the paramedics.
Now, a reminder, there's always a board-certified physician at a Rex Express Care, and there are 4 Rex Express Care centers in Cary, Holly Springs, Knightdale, and Wakefield. And you can even go to rexhealth.com and check wait times online. Okay, real quick. This is Daryl from Knightdale. Disadvantages of using Coumadin with a pacemaker.
In general, a lot of times they work together. People that may have a pacemaker may have rhythm problems as to why they're on Coumadin. In general, as long as they're not having surgery or other things in the forefront where being on a blood thinner would be a bad thing, there's not too many disadvantages to it. But for some reason to be on that, we need to know their diagnoses and just to follow up with them to make sure they're on the right medicines.
Okay, this question from Gold Squirrel. At night, hot flashes with sweat and then extreme chills. She doesn't have a period and she wants to know why.
It sounds a lot like menopause. It's kind of the bookends of our fertility. We have puberty and we have menopause. And typically the diagnosis of menopause is 1 year without a menstrual cycle. And with your estrogen levels dropping, that's when you get the hot flashes, the insomnia, kind of general irritable issues. And so some women should seek care from their OBGYN to talk about, you know, do I want to go on hormone replacement therapy? Am I candidate? Should I? It also depends on your age. You know, if you're around 51, that's typically the average age of menopause. But if you're younger, then we want to make sure we're retaining fertility and stuff like that.
Okay. This question from Raleigh, continuous edema, in bed with it, even some medication, but it's still present.
I think the 2 most concerning things would be chronic venous changes, where the veins in our leg aren't moving fluid like they should. And then also maybe they were developing early signs of heart failure too. That's tough to say that without seeing the patient, but it's probably something to be evaluated by start with a primary care physician.
Okay, this is Lisa in Raleigh. Late 40s, forgetfulness, fatigue, cannot get the energy up that needs to deal with life. What can she do? Where should she start? And we talked a little bit about this in the beginning. There's a lot of options out there.
Right. I think that evaluating her sleep is key. So is she getting good rest throughout the night? Is she having difficulty falling asleep? And you know, maybe she needs. We have something called sleep hygiene in medicine, where you need to evaluate whether you're drinking too much caffeine, sleeping inappropriately during the day. Make sure that you don't watch TV or read books in bed so that you can get adequate sleep, because you start there and then you can assess. Yeah.
Okay. This is Crystal from Henderson. She has high blood pressure, but the medication's not working. Is there anything else she can do?
Yeah, obviously they need to follow up with whoever prescribed that prescription and let them know that, and keep a log of their blood pressure at home to see if there's some times when it may be better controlled than others and may need a different medicine.
Okay, this is Violet in Durham, has leg pain, has lost hair on her legs, and has a lot of spider veins in her legs. Is there a disease that can cause the hair loss?
Yeah, this a lot seems like maybe peripheral vascular disease, maybe the arteries or the veins in the legs. And it seems like a good screening test, like measuring the blood pressure in the arm and also the ankle may be a good thing for her too.
Okay. Also, hypothyroid can contribute to some of those symptoms. So also making sure that she gets that checked out too.
Okay, absolutely. Now we're going to have a final round of questions right after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Okay, this is Deborah from Princeton. Taking Ambien, having memory problems, is there a relationship between drugs and memory loss?
There's many drugs can cause memory loss, but in particular Ambien, if you take it on a nightly basis, it can definitely cause some memory difficulties. And there were some newer recommendations or guidelines that came very recently that maybe women should be taking only maximum dose 5 milligrams rather than 10 of Ambien.
Okay, this is Carolyn in Raleigh. She has IBS and she wants to know what could be done to make her feel better.
It depends on if she has diarrhea predominant or constipation predominant IBS. There's a lot of different treatments, some newer treatments that have come out just very recently for that. I think part of it is that IBS is a diagnosis of exclusion, so you'd want to make sure you don't have any other serious underlying gastrointestinal disorders.
Okay, this is Barbara from Rocky Mount. Short of breath when walking up the stairs, takes a few minutes to catch her breath. She's 63 and 219 pounds. She sleeps a lot, wants to know what she can do.
This is back to what we talked about earlier about maybe being evaluated for sleep apnea. Sometimes when people have exertional symptoms, it could be heart-related as well. And that's probably a really good thing to start with the primary care and get evaluated for to see if they can get to the bottom of it.
Okay, this is another question for you. Anne from Fuquay. She has a heart murmur. She has a heart murmur. What can she do about it?
In general, we follow heart murmurs based on what we hear in the exam. So she does need to be examined by a physician to hear what we're dealing with. And then number two, she probably needs to get an ultrasound of her heart to see exactly if they do hear a murmur, to what degree, if there's a leaky valve or a narrow valve, or if there's even related to the heart at all. And that's probably the next thing to do to follow up.
Okay. Question from Diane and Clayton. How important is an organic diet for good health?
That's tricky. I don't think that there's a lot of evidence that an organic diet is really a lot healthier for you. I think that just to think about it in general, that eating foods that are free of pesticides, that the animals don't use antibiotics is probably a good thing.
Okay. This is from Diane. Okay, we just did that, sorry. Kelly from Clayton. She has a 4-year-old grandson who has had a fever on and off for the last 5 days between 101 and 103, doesn't have an appetite, and he's sleeping more. Could it be more than a cold? And he did have a flu shot 9 months ago. So what would you recommend for a guy that age, 4 years old?
4 years old, he probably should go see his doctor. Yeah, I think so, yeah. After a couple days, if it's just not getting better, for sure see the doctor.
And how do you know exactly when it is the flu? How do you diagnose when it actually is the flu?
You know, a lot of it is clinical, so high fevers, muscle aches, the cough, but also there's rapid flu tests that we do in the office to really sort of diagnose it. So it's a combination of clinical and tests that we can do.
And what's your feeling about offering Tamiflu if you are diagnosed?
Certainly, if it's early enough in the course of the disease, 24, 48 hours, it can shorten the course of influenza and also make the consequences less of the illness.
But we also recommend it during pregnancy when you've been exposed to someone who may have the flu, just because flu in pregnancy can be very difficult to manage.
Okay, and this caller from Tarboro had gastric bypass, lost about 115 pounds, but has a lot more to go. She wants to know what else she can do to lose that weight. She's already had gastric bypass. Any advice?
I think exercise is a big one, and changing things in her lifestyle just to try and work on that.
Yeah, and I mean, it is hard for folks that have gone from zero exercise. I mean, even absolutely. 30 minutes a day can be overwhelming.
But it's great she's already lost that much weight. Right. I mean, that's a great thing.
And so to get started slowly, just maybe go for some walks and get used to it. And start with 10 minutes of walking, and then you can work your way up to 15, 20 minutes. But weight does plateau, and so it takes a little bit more work after you've lost 115 pounds.
Okay. This is from Neil and Raleigh. After a herpes exposure, how long after exposure does a herpes show up?
I think it just depends if you've already been exposed, what your immune system is. But we'll see it anywhere from 5 days to 2 weeks sometimes. Typically your first herpetic outbreak is going to be kind of some fevers, chills, myalgias, not feeling very good, and you definitely want to seek care with your physician. If you haven't had any of those symptoms, you still may want to get a blood test to see whether or not you have antibodies or been exposed to it. And typically, at the time of exposure, maybe even a few months later, just to see if anything else has developed.
Okay, and real quick, we heard dark chocolate is good for your heart, right? But not all dark chocolate. Tell us what we should be looking for.
Typically, the higher cocoa factor, greater than 70%, has been shown to help reduce some of the events. That doesn't mean to go binging on chocolate, and we all love our milkshakes and ice cream, but typically it's the dark chocolate, not the milk chocolate.
Dark chocolate, not milk chocolate. Okay, great. As always, consult with your physician about any health concerns. Thank you guys so much for answering these questions, and thank you to our phone bank. They are still taking calls over there. Join us next month for a Rex and Call when our topic will be Love Your Heart. That's Monday, February 18th at 1 p.m. You can email us your heart-related questions ahead of time using Rex on Call at rexhealth.com. Thanks so much for joining us. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.